Are you ready to be uncomfortable and talk about kind of a taboo body part? Because this cutting edge therapy gets oxygen all over in your system. It helps for chronic stomach problems, energy problems. It's just kind of a little bit weird. You should check it out. Hello everyone, Dr. Jason West in the West Clinic. Excited to talk to you about oxidative medicine because I think it's one of the key things that helps with chronic disease and anti-aging and hormone balance and how to help with every facet of your life. Because one of the reasons why we age and we get sick is because we run out of oxygen. And then what happens as we break down energy in the cells, if oxygen is the final electron acceptor, if we have enough oxygen, what happens is we get carbon dioxide and water as a metabolic breakdown. If we don't, and we run out of oxygen and we go into what's called anaerobic glycolysis, and we have pyruvate and lactic acid. Now, everybody's heard about lactic acid, or at least most people have. Lactic acid is what happens when you go to the gym and you start to exercise, and as you run out of oxygen, what happens is your body starts to create lactic acid, which is sore, which makes your muscles achy, and you go home for a time period, and when you repay the oxygen debt, what happens is the soreness goes away. Now, unfortunately, with some people that have fibromyalgia, that soreness never goes away. So they feel like they've been going to the gym and having that achy pain, that soreness all the time. Now, one of the ways to help it so that you can have your hormone balance and that you can have your energy and vitality, and if you have fibromyalgia or you know someone that does have fibromyalgia, if you get enough oxygen into the body, you can repay the oxygen debt. It really, really helps to decrease chronic disease symptoms and is really helpful for fibromyalgia, for chronic fatigue, and chronic infections. And using oxidative medicine, either a combination of oxygen, through hyperbaric oxygen chambers, even through condensers, or exercising with oxygen, or using ozone therapy, which is you can use through hyperbaric ozone treatments. You can do major autohemotherapy, or the treatment that we need to talk about is insufflation therapy. It's an amazing, safe, and easy way to get extra oxygen into the body to help with infections, to get rid of acid, to really, really help balance and harmonize your body. What we like to do at the office is to do something called insufflation therapy. And I always really enjoy seeing people's facial expressions when I tell them how to do this, but the outcomes that we get are amazing. Matter of fact, there's a researcher in Cuba named Silvia Menendez that has amazing research on all of the different conditions, many, many studies on how rectal ozone therapy or insufflation therapy helps to reverse and turn around chronic disease. Now, this is what you do. You take a little bag of about 500 cc's, so it's about that much. You take a little tiny catheter, you put a little bit of lubrication on it, and you insert it in the rectum up into the colon. Now, it's so hard for certain types of men to even consider this therapy because they turn around, their face crinkles and say, no way, and in HE double hockey sticks is that going to happen? And then what happens is they see the amazing benefits because it helps to neutralize acids. It's amazing for stomach problems. And when you put it into the colon, it's not quite as foreign as everybody thinks because the colon has actually been termed the third lung. There's actually been different surgeons that have put oxygen into the colon when they're doing surgery. It helps with wound healing and helps for people to get better quicker. And when you systemically treat people through insufflation therapy, putting that ozone, and literally it's one part of ozone to, zillions of parts of oxygen, what happens is it absorbs everywhere. It's effective therapy for chronic pain syndromes, for infections. We've helped multiple wounds from heal that weren't responsive to hyperbaric oxygen and IV antibiotics using this approach. It's not uncomfortable. You actually show people how to do it. You don't even have to have a staff person do it for you. We just show you exactly how to do it. You roll in the tube of ozone and you try and hold it for as long as possible, hopefully anywhere for 10 to 20 minutes. With people that have bowel problems like ulcerative colitis, anal fissures, irritable bowel syndrome, malabsorption syndrome, it's amazingly effective. It helps your entire GI system to heal. And this is one of my very favorite therapies. If I was stuck on a desert island and someone told me this is the only treatment that you could take with you, this might be it because it's so effective in systemic conditions. And again, just a little catheter, you insert up into the colon, you roll the bag forward. when you first do it with people that are having toxic bowels, usually you'll make people go to the bathroom right away, and which is really helpful to get junk out of the system. And then over time, you can keep that oxygen therapy in your system longer and longer. You'll actually start to smell it coming through your skin. The oxygen therapy, it smells, just like outside after a rainstorm. You have lightning go across the sky, and you have that fresh, earthly smell. You'll see that come out through the skin. It's so healthy for people. If you have a chronic healthcare condition, I hope you'll consider this therapy. Rectal insufflation therapy, I've seen it help a variety of conditions. Thank you so much for watching the video about insufflation therapy. It's a little awkward, it's a little taboo, but it gets amazing results. Please don't have a close mind about it until you actually try it, because it gets amazing outcomes. You'll see a report that you can download in the description of the video. Please like us, and if you'll click on the little bell, you'll get an email every time we put out a new video.